Hi team, Blake here, and today we're going to ask the question, how big would your practice be if you never lost a patient? This is one of our favorite questions when we work with a practice owner, but one of our favorite questions when we work with practitioners and we train people's teams as well. How big would your practice be if you never lost a patient? There is an obsession in the market about getting patients, needing patients. It's all about patients, it's all about patients. And yet so often we have a massively leaky bucket in our business. You know, they say it's 9 times easier to get somebody to spend money with you who's already spent money with you before than it is to get a new patient. So when there are so many people focusing on getting new patients and doing marketing and, you know, doing more social media, the smart ones are looking after the patients they already have. The smart ones are making sure that they rebook their patients when it's ethically right to do so, right? You don't book a patient if you've discharged them, although you might book them in for a 12-month checkup, depending on what you do within your practice. But we want to look after the patients we already have. And so few people are actually doing this effectively. You know, so when we look after the people we have, we make sure we monitor how many people we rebook. We then check in on the DNAs. You know, if people cancel, you know, do we rebook them? If they just don't show, do we get in touch with them and say, hey, look, you know, I know life gets in the way, but obviously you were part way through a treatment, so let's book you back in. And there is so much gold right in front of people when we ask this question, how big would your practice be if you never lost a patient? What could you do to look after the patients that you already have? You know, so like I've already mentioned, we always track on a monthly basis the rebook rate of every practitioner. We look at, you know, how many people cancel and don't rebook, the CNR, how many people do not attend, the DNA, you know, and then we look back at people and we reactivate our old patients. You know, we actually pick up the phone and get in touch with people if they haven't had an appointment in a long time and we feel like they need a follow-up. Well, let's get in touch with them. And yeah, like, people don't like picking up the phone and they think, oh, that's a lot of work. Can't we just do some online stuff and throw money at it and just hope that works? Whereas reactivating old patients who maybe haven't seen you for 12 months, who you know need a 12-month review on, say, for example, their orthotics, or may just need a checkup. If you're in the kind of practice where you think healthcare should be preventative, not just curative, which is where I believe, you know, better to get a chiropractic adjustment every few months rather than only go in when you're in pain. So if we believe that, then we can actually rebook patients in advance to make sure we maintain their health. So spend some time thinking about this. How big would your practice be if you never lost a patient? Look into the database you already have and go mine it for gold. Go and get in touch with people, send them an email, send them a text, pick up the phone and actually reactivate some of those people. And start treating your patients like gold. Start treating your patients as if you could never get another patient. How would you behave differently? You do that and your diary will look full for months to come. Hope that helps.